I believe that some children will do fine with behavioral intervention. So, for example, the things I just mentioned, the getting off their screens and all. There are kids and adults who do need medicine to sleep. And in some cases, it may be genetics, right? They may, for example, have a really short sleep duration or just have trouble with their circadian rhythms. In other cases, the parents are just super stressed and they can't even fathom putting a visual schedule or a bedtime routine together for these kids. They're too overwhelmed. And I get that. I myself have been through being a parent and having children who weren't sleeping well. It's very exhausting. So what we do is we turn to medicine sometimes, but we're very careful how we do it. We always want to start low dose, increase slowly, make sure that we don't try to bombard a child with too much medicine, because every medicine has side effects, and we want to try to prevent those. Another really important principle is to not combine too many medicines at the same time, but try to limit treatment to one medicine, or if you have to start a second medicine, start low, go slow, really try to reduce the number of medicines a child is on. I also am a big believer that we need to listen to the parents, and we need to listen to what they're telling us about how the medicines are working, what the side effects are. That's super important. Once a child is sleeping well with a medicine, I do my best to try to get the parent to implement those behavioral sleep interventions I mentioned, like the limiting screen time, increasing exercise, limiting caffeine, because that will oftentimes be more effective than the medicine alone. And sometimes you can even jumpstart a kid and get them on a medicine and then take away the medicine once the parents have implemented the behavioral strategies. And then the final push I'll say is that we need more studies, particularly of some of the newer medications, but also some of the older medicines. The newer medicines, a lot of drug companies are reluctant to enroll kids with autism or other disabilities in studies because they're worried about side effects. But we really need to be able to know how these medicines work in these populations. Otherwise, we can't really prescribe them properly. And then we also, I think, need to really look at some of these older drugs that have been around, because some of them can be quite effective, but they're hard to sometimes get approval to study, or there's no funding to do those studies. So I really do believe we need to have more of an investment by the pharmaceutical companies or the different governments across the world in really allowing us to come up with evidence-based strategies for treating this population and kids and adults with intellectual and developmental disabilities in general.